But I'll be forever, excuse me, grateful to Dr. David Goldstein, who really, again, gave me a name and a path for my passion. Meanwhile, my search for female role models and mentorship continued. And when I was in graduate school, Dr. Joanne Earp, who was the then chair of the department, was kind of my professional mother. And I really looked to her to kind of take me under her wing, which she did. I was one of Joanne's girls, as they called us. And so she taught me a lot about what it means to be a professional woman and also a mother. And I saw her, and I worked very closely as her research assistant and saw the ways that she struggled with really being a top woman in her field, being the chair of a department, but also struggling to make it to her kids' events. And she was always running, always rushing, I remember, and just feeling kind of overwhelmed with all the work that she wanted to do and also to be fully present for her family. So I was learning about that too. But Joanne's professional interests were different from mine in the field, and so I was looking for a role model in sexual reproductive health and rights. And I found that in Kathy Kerr, who was a local activist here in Durham. She was at the Durham County Health Department, and she was doing amazing work on HIV and STIs and really community engagement, really engaging the community to grapple with the issue of HIV and addressing it head on and working with diverse communities. And so it was such a relief to find her and to work with her. And she was an incredible teacher to me. Unfortunately, she died very unexpectedly and suddenly of a brain aneurysm and was literally kind of taken out of our lives. And so I was devastated and yet really determined to continue her legacy. And I ended up assuming her position at the health department. I was still in graduate school, but I just felt it was so important to keep the work going, and ended up really partnering with the then health education director to do this important community awareness raising and HIV STI prevention work. Then I decided I really missed international work. Global really is who I am. My family grew up living in a lot of different countries, and so working only in the US just wasn't working for me. And so I went to IPAS, and I chose IPAS, an international NGO, because it was one of the few international NGOs where the majority of the leaders were women, even though, as we know, many of the agencies focusing on sexual reproductive health and rights are working with majority women. Often the leadership, the highest level of leadership, is not always women. And I was very deliberate about wanting, again, that mentorship and leadership from women. And when I got there, I was very intentional about asking for mentorship. And some of the leaders weren't really kind of mentor-minded, I'll say. And I think it's because in their generation, they were the first. You know, they didn't have female role models and mentors to guide them in their career, and they hadn't developed that mentorship mindset of then helping the next generation along. And so I almost had to kind of coach them on how to mentor me and other young female leaders who really needed these women leaders to kind of to guide us in our careers. And I was fortunate enough to have developed close relationships with them, and they remain close friends and mentors to this day. But this search for mentorship and leadership with people who are similar to us is not uncommon. And there's a really urgent need to develop more diverse leadership in the global health field more generally. We need leaders who can really represent the people that all of these research projects or programs are designed to serve. In her article, The Crime of Gender Inequality in Global Health, Laurie Garrett really asserts that there's no way we're going to be able to grapple with and solve the world's health problems unless we really engage in women's empowerment, and that includes women's empowerment within organizations as well. So women in leadership positions in these organizations. Worldwide, women make up about 75% of the paid health workforce, and if you add unpaid or partially paid or underpaid, often community health workers to that, the number rises to about 90% of the health workforce is female. And yet when we look at the leadership of a lot of the major health organizations, many of them continue to be men. And it's fine to have men in leadership, of course, but we also need more women in leadership, and we need more diverse people in leadership. From the 1960s to the 1980s, really nearly every major direction in the field of global health, including hundreds of millions of dollars that were given as grants through the Rockefeller Foundation, the World Bank, the World Health Organization, where those monies went were decided by a handful of mainly Western white men. And yet you look at the programs of who those programs are designed to serve, and where is that representation, again, of how do people decide where the money goes? And it's not surprising that the issue of maternal mortality and morbidity, pregnancy and childbirth issues were really grossly neglected during that era, which I think is reflective of the people who are making the decisions about the funding. And so we know that in our field of global sexual reproductive health and rights, the problems that we're addressing, the root cause of them often is sexism and a blatant disregard for women's rights or people's rights, because we know that it's predominantly poor women, rural women, young women, indigenous women, ethnic minority women who really bear the disproportionate burden of these reproductive health problems. Even in lower income countries, we know that if you look at it by wealth, wealthy women will often still be able to access better health care than young, poor, rural, and ethnic minority women. As former FIGO president, Professor Mahmoud Fathallah said, mothers are not dying because we don't know how to save them, but because society has decided that their lives are not worth saving. And so we have to decide that women's lives are worth saving, and we need diverse leadership to develop the solutions to resolve women's health problems. Another important gap that we see is a gap based on ethnic minority or people of color. Even here in the United States, in North Carolina, in the US, surveys of nonprofit organizations show that even though the nonprofits are many of them are often serving primarily people of color, the leadership gap is there. And so when you look at the board of directors and the most senior leaders, they're predominantly white women and men. And so again, we have to address this leadership gap. I've been really inspired by Dr. Tedros of the World Health Organization, Director General, and the UN Secretary, General Antonio Guterres, who are both men who are really prioritizing hiring diverse teams. For example, Dr. Tedros, when he announced his senior leadership team, said the team represents 14 countries, including all WHO regions, and is more than 60% women, reflecting my deep-held belief that we need top talent, gender equity, and a geographically diverse set of perspectives to fulfill our mission to keep the world safe. So imagine that there is a senior leadership team at the World Health Organization that actually represents the world. And this is kind of a novel concept. When he announced it, everyone was, including me, was retweeting his tweet as though this was, this kind of revolutionary idea that the leadership represents the people who are being served. So diversity matters. And number two, the second theme, is around humility or leading from behind. What if humility was the new confidence? How many of you, when you were thinking of the qualities of a leader, thought of the quality of humility? Did anyone? I'm curious. Yeah? Okay, maybe a couple? You did? Yeah, so important. And yet, I think for many, confidence would be kind of a trait that we would think of more often, or many people would think of more often. And it really takes courage to be humble, because to be humble, one has to be vulnerable. And there aren't a lot of leadership models where leaders are humble. And so it takes courage to be that kind of leader and to really kind of be visibly humble. And for this theme, I think about my supervisor when I was working at the Durham County Health Department, Jacola Fisaha, who is a small man in stature, but a big man in heart. And he taught me so much about humility. When I was a young professional,